careful assessment, one has to make up a decision that is suitable for that particular patient. So it's not one treatment for all. It depends on the patient, what they have and their expectation, and how it affects their day-to-day living and lifestyle. If somebody has severe pain and cannot sleep at night, and this is affecting his activity of daily living, he will need something done urgently. Probably he will be the candidate for surgery sooner rather than later.
Okay. You mentioned briefly physiotherapy. You've got a team of physiotherapists up at Hartswood that you work alongside?
Yes, I have a team who have a particular interest in the shoulder. We work very closely together. We have set up our protocols and the referral pattern. Usually they see patients who have problems, and we communicate together, both for assessment by themselves, and on occasion we do assessment together, particularly for complex shoulder problems. And also they look after the patient in their rehabilitation, which is very important.
Okay. We spoke very briefly about the things that you're looking for in a patient before you decide to operate. At what point would you think about recommending surgery to a patient? Is that also on a patient-by-patient process?
Absolutely. Usually for the dislocation, for the recurrent dislocation, the fact that the shoulder remain unstable and stop them carrying out their hobbies is probably a good reason to stabilize them. So that will indicate keyhole surgery to stabilize the shoulder. For a patient with pain that has persisted despite the treatment we tried, then surgery is the answer. On the other hand, if somebody has a rotator cuff tear, they don't heal until we repair them, then that will be an indication to repair sooner rather than later.
Thank you very much. You're listening to Body Talk here on Phoenix 98 FM in association with Spire Hartswood Hospital. Our guest tonight is Mr. Ali Al-Sabti, who's just one of the consultant orthopaedic surgeons up at Spire Hartswood Hospital.
Community radio for Brentwood and Billericay. This is Phoenix FM. Body Talk, sponsored by Spire Hartswood Hospital in Brentwood, your local private hospital.
You're listening to Body Talk in association with Spire Hartswood Hospital here on Phoenix 98 FM. Our guest this evening is Mr. Ali Al-Sabti, who's a consultant orthopaedic surgeon at Spire Hartswood Hospital. And if you miss any of the special guests here on Phoenix 98 FM on Body Talk, you need to get over to the Spire website, www.spirehealthcare.com/Hartswood/podcast, and you can download and listen to them again at your leisure. Welcome back to the show, Mr. Al-Sabti.
Thank you, Steve.
Thank you for coming down here this evening. Right, what are the operations you commonly perform?
The commonest operation I do is shoulder arthroscopy, i.e. keyhole to the surgery to the shoulder, sorry.
Yeah.
Usually this for what's called impingement syndrome, which I alluded to before, that I see about 60% of my work is that.
Yeah.
That involves putting a small telescope in the shoulder and through another small puncture wound carrying out whatever surgery is necessary, usually filing some of the bone that throbs on the tendon through the keyhole surgery.
Okay, so you're filing the bone down?
Yes, you're using, it's very highly technical operation because you're using burr, which does about 4,000 RPM in the shoulder, and that usually remove the bone very easily.
Yeah.
We pump water into the joint, and we suck it at the same time with the bone that's been grinded away.
So you take the debris out as well?
Absolutely.
Excellent.
Absolutely.
You mentioned very earlier, or a little bit earlier, about the dislocation in young athletes getting a dislocation, and then you said that you intervened to stop that happening again. So what exactly would you do in that circumstance?
Okay. You remember that we said the shoulder is very highly mobile joint.
Yeah.
And the reason for being mobile is the socket is very shallow, which allow this extra movement. However, to make the shoulder stable, there is what's called a labrum, which is at the front and the back of the shoulder. This is like a cartilage rim, which make the socket deeper. When you dislocate your shoulder, you damage this, and this labrum then slips away from the edge to the side of the socket.
Yeah.
This makes the socket shallower and make the ligament lax. So when we stabilize a shoulder through keyhole surgery, we visualize all that very clearly and accurately. Then using osteotomes and periosteal elevator, which is sharp instrument, we elevate it from where it shouldn't be there. We lift it back to where it belongs, and then using metal anchors or bioabsorbable anchors or sometimes plastic anchors, depending on the case.
Yeah.
we drill holes into the socket face and reattach the labrum and the ligament back to where they belong, all through the keyhole surgery, versus the open surgery that used to be done before.
So you're not actually, there's no open wound as such.
There is usually
wounds. 2
puncture wounds for the surgery and 1 puncture wound for the scope to go in.
Okay, fantastic. You were mentioning that you carry out about 5 or 6 types of operations.
Yes.
What would they be?
The commonest one is what's called an arthroscopic subacromial decompression, which is, we file the bone as I mentioned. The other operation I do is repair of the rotator cuff, which, if patient has pain in the shoulder, left unattended, eventually may rupture his cuff. This then require repair, and again that is very technical operation, very highly technical operation, challenging, where the cuff or the tendons of the rotator cuff are repaired back through the keyhole surgery, again using metal anchors. And this technique has evolved over the years, and the results are becoming increasingly better. My third operation is for a frozen shoulder, where through the keyhole surgery the inflamed tissue inside the shoulder are removed and all the tightened ligaments released. Not to forget shoulder replacement, which I also carry out, usually doing a surface replacement.
Right. Okay. Surface replacement, what's that? Just a partial?
It's a partial replacement. It gives good results.
Yeah.
It is, again, less invasive and is conserving the patient bone stock by not removing the ball part of the socket, which is the traditional way, and recapping the worn cartilage with metal cap.
Right. Okay. Sounds very complicated.
It is.
What about recovery? Do you have to be very careful after surgery to avoid a recurrence of the original problem?
Oh, absolutely right. It is one of the most important things is the rehabilitation, and that's where the physiotherapy comes. There is absolutely no point of carrying out surgery unless you have proper rehabilitation in place, and that include specialized physiotherapists to take the patient through different stages of their recovery. If you're going to do a repair, just to protect the repair and maintain movement. If you just done a decompression, is to get the movement back as soon as possible and not allow stiffness to happen.
Okay, so it's you need to keep it mobile.
Depending on what it is, physiotherapists will guide them through the rehabilitation to keep the movement there and prevent damage to the repair.
Tonight's guest is Mr. Ali Al-Sabti, who is a consultant orthopaedic surgeon at Spire Hartswood Hospital, just one of them up the road from us here at Phoenix 98 FM.
Body Talk, sponsored by Spire Hartswood Hospital in Brentwood, providing private healthcare for all the family.
You're listening to Body Talk on Phoenix 98 FM in association with Spire Hartswood Hospital. Our guest tonight is Mr. Ali Al-Sabti, who is just one of the consultant orthopaedic surgeons at Spire Hartswood Hospital. Right, Mr. Sabti, in the introduction I mentioned the new shoulder clinic at Spire Hartswood. Can you tell us about the clinic, which I understand is launching this week?
Yes, at the moment, and traditionally when a patient comes here, consultant, they come in for assessment. They can have an X-ray on the same day, but if they require any further investigation, that means booking a second appointment to go and have that investigation, then a third appointment to come back and see the consultant for the result.
Right.
Now, that is not very patient-focused, and I wanted to do something that is patient-focused, that patient has to come first, and therefore the plan is to, when the patient comes to see me, I'll assess the patient and, if appropriate, request X-ray and ultrasound, which is very accurate for diagnosing most of the shoulder problems.
Yeah.
And that can be carried out on the same day, and following which I'll have the result immediately, working in association with a musculoskeletal radiologist who's expert in that field, and therefore I can give the patient a final outcome of all that and the result and tailor the treatment according to the need in one stop. And hence it's called one-stop shoulder clinic.
Excellent, excellent. Launches this week?
Hopefully, yes.
Okay, that's brilliant. How would that impact on your time? You know, I assume historically you've had appointments made and you kind of know where you're heading throughout your day. This is going to be slightly random.
It is You're absolutely right about that point, and it is very difficult, but we've managed to come around it by allowing more time for consultation, and at the same time booking certain slots for the one-stop clinic where myself, the radiologist, the X-ray girls are all geared to deal with this particular situation.
Sure.
And therefore provide a service that is unique.
Brilliant. Excellent. Good work. And if listeners want to know more about this one-stop shoulder clinic, who do they contact up at the up at Spire Hartswood?
Yes, they can speak to Shirley at the inquiry line, which is 01277 266 761. They can have a look at the website or contact my secretary, who is based at the Hartswood.
Excellent. We'll get those numbers put up on the website as well, and the Spire website, which is www.spirehealthcare.com/Hartswood, and people can go there and find out a little bit more. And there'll be links on the Phoenix FM website as well. That's excellent. Mr. Al-Sabti, you've been a very interesting guest this evening. You're listening to Body Talk on Phoenix 98 FM in association with Spire Hartswood Hospital. The first guest here on Body Talk for 2010 has been Mr. Ali Al-Sabti, who's one of the consultant orthopaedic surgeons at Spire Hartswood Hospital. If you wouldn't mind, Mr. Al-Sabti, just running through those contact details again, just in case people didn't catch them.
Yes, thank you. The contact details is surely on the treatment inquiry line on 01277 266 761. Alternatively, you can check at the website, Spire website, or contact my secretary at the Spire Hospital.
That's lovely. Thank you very much. I'd like to thank you for coming down this evening and wish you a very happy new year.
Thank you. Same to you and your listeners.
And hopefully we'll see you again very soon.
Thank you.
You've been listening to Phoenix 98 FM. You've been listening to Body Talk in association with Spire Hartswood Hospital.
Body Talk, sponsored by Spire Hartswood Hospital in Brentwood, your local private hospital.